First off, tell me your name and a little bit about you.
I'm Lynne Reeves. I am from Rome. I went to school at the University of Georgia, and I received my dietetics degree there, so I'm a registered dietitian. But I work for the Northwest Georgia Area Agency on Aging as the wellness coordinator.
Tell me what all that job entails.
Okay. Well, we cover 15 counties, so that would be Dade County down to Haralson and Paulding County, and then over to Fannin, Gilmer, and Pickens County. And we have 19 senior centers in those areas. And so I'm responsible for the nutrition education provided, the physical activity that goes on at the centers, also falls prevention, medication management. And a lot of people don't know us by the Area Agency on Aging, but if you've heard of Meals on Wheels, some caregiver services, those are the things that we do.
What do you enjoy most about your job?
Well, I enjoy working with the people out in the community. I used to be a food service director and just working as a dietitian in hospitals, but it's just different being able to travel around and meet them where they're at home and spend more time with them. One of the things I enjoy most working with the Area Agency on Aging is a senior farmers market. So we, during the summer months, we travel with 2 farmers from Tunnel Hill, Georgia, up in Whitfield County, and we provide fresh produce to seniors. We served about 900 this year.
What's the hardest part of your job for you personally?
For me personally is to do everything in the time, to be traveling, covering 15 counties, and to be able to do everything you need to do.
What about the funding for the program?
Okay. We're covered with state, federal, local funds, and some grants cover our programs. And a lot of our funding now, the programs we do programs have to be evidence-based, meaning that they've done research to ensure that they have some positive effect rather than us just thinking this program's a good idea and doing it. So that is what my main focus now is, doing the evidence-based programs.
Over your years of doing this, what are some of the roadblocks and some of the issues that you've experienced that allows you to do a better job and just reach as many people and touch as many lives as you can?
Okay. I would say the biggest roadblock is me being one person and covering 15 counties. These evidence-based programs, we can train others to present them as volunteers, or other agencies will partner with us. And I think getting people to give of their time to help present these programs. We try to get people in these counties to be volunteers to do the programs. And if we could get more volunteers, we can present more programs.
How many volunteers do you have right now?
7.
How many are you looking to find?
As many as will volunteer.
How would somebody, if they want to volunteer?
Well, they can call our number at 706-295-6485, and they can ask for me, Lynne Reeves, and I could speak with them. And I can tell you a little bit about the programs. There's 5 programs that are evidence-based that we do. There's a chronic disease self-management program, a diabetes self-management, Matter of Balance, which is a falls prevention program, Tai Chi for health, and Powerful Tools for Caregivers, which is a caregiver program. So just to tell you briefly about those, the chronic disease is it's over a 6-week period, and giving people the tools they need to manage their health, such as sleeping better, eating better. We talk about healthy eating, exercise, medication management, a lot of those things that help people live better. The diabetes focuses more on diabetes. And then with the Matter of Balance, it's an 8-week program, and by week 3, we're introducing chair exercises. I've had participants in wheelchairs and on canes take the program, and we just modify it to meet their needs, but that consists of getting them to be more physically active to build the strength and flexibility in their legs to prevent them from falling. And the Tai Chi is similar. It builds strength and flexibility. And then the Powerful Tools program is more to give caregivers the tools they need to just to be better able to deal with when they're caregiving, because it's a fact that a lot of people that are caregivers, they may not live as long as the people they're caring for because they quit taking care of themselves, and that's what we want to help them do.
What age range do you help to and from?
Well, through the aging agency, we usually 60 or over or anyone with a disability, but with any of these programs, age 18 and older, because we realize chronic disease, diabetes, that doesn't just start at age 60, it starts a lot earlier than that.
And finally, if anybody wants information, whether to volunteer or to get assistance, how can they find you?
They can call me again at the number before, 706-295-6485, and I will also mention right now we're able to offer all of those programs at no cost. So that's a big benefit too. We come to the area and do it. It does not cost them. We bring everything to them.